I am Jay Parikh, and I'm from University of Texas MD Anderson Cancer Center, and I'm delighted to be here. I have no relevant conflicts to disclose. I guess I kind of wish I did. In terms of the next 10 minutes or so, I'll try and make it less actually, so we'll have time for questions. We're going to look at strategies to actually retain radiologists. Just curious, before we start, how many of you right now in your practice have a posting and looking to hire a radiologist? Okay. How many of you are not? We have one. Okay, lucky you. We definitely are. So let's look a little bit at the landscape. And I want to emphasize that this is not a new problem. We think that it is, but it's not. We know from 2002 to 16, we're going to first of all look at imaging volumes, and then we're going to look at transitions. From 2002 to 2016, the annual growth of imaging of ultrasound, CT, and MRI already was increasing 1 to 5%. Imaging volumes in the emergency department are continuing to rise, not to mention the number of images per study has risen repeatedly, and we have an aging population with increased healthcare needs, so the demand on actual imaging is going to increase and continues to increase. One of the things we need to look at, though, is the radiologists themselves, their dynamics in terms of workflows. The 1-year separation rate actually increased in the pre-COVID era. We weren't paying attention to it, but it went up from 13.8% in 2015 to almost 20% by 2018. Then we had the Great Resignation during COVID, where, depending on the literature you read, about 20% of the US healthcare workforce resigned. COVID also accelerated the teleradiology workforce, which has definitely impacted the way we do things. And there are job listings everywhere. In 2024, there were over 1,700 job listings. I just spoke at the Society of Breast Imaging, where there's over 300 job listings now in the SBI. There's no shortage of work out there, and people are moving. So if you want to retain your practice strength, you have to do things to try and stop the leakage, right? That's how we're going to survive. That should be priority number one. Rather than working on recruitment, is actually keeping the people you have and valuing your human capital. So briefly, we're going to talk about burnout. I'm going to look at burnout from the scientific point of view and definition. Burnout is very significant. It is a syndrome that has been defined now and accepted by the World Health Organization, resulting from chronic workplace stress. And notice the emphasis on the occupational context that is unsuccessfully managed. Multiple peer-reviewed studies have been carried out that have looked at the prevalence of burnout across multiple subspecialties in radiology, with the range being between 50 to 80% in these studies, some of the early work, showing that burnout is very prevalent. One of the things with burnout you can do, though, because it's scientifically defined, is look at associations and links. And one of the important things to understand, and this is a landmark study that was published in JACR in 2021, and this looked at over 450 radiologists in the Physician Wellness Academic Consortium in the United States. But using their models of measurement, there was a prevalence of burnout of 37%. But the intention to leave amongst the radiologists who actually did this survey was 1 out of 3, 33.3%. And the intention to leave was significantly higher, over double, in those who were burnt out versus those that were not, 51% versus 24%. So if we do things to help manage burnout, we can potentially help intention to leave and preserve radiologists in our practice. That's the mindset. This is actually a model that's been adapted by the AMA. If we assume a radiologist has meaning at work, there are 6 primary drivers of burnout: workload, control, work-life integration, social support, organizational culture, and efficiency and resources. If they're less optimal, the scale tips towards burnout. However, notice that if we actually increase vigor, dedication, and absorption into the practice, we shift the conversation and the narrative towards engagement. How do we actually move the needle towards professional fulfillment? And we have to thank the people from Stanford who came up with this model. Professional fulfillment, just to be really clear, can be defined as the perception of either having reached one's most important career goals, or at least a positive evaluation of being on the right path to achieving that. Using that as a core tenet of what we're going to call fulfillment, there are 3 components to achieving fulfillment: culture of wellness, efficiency of practice, and personal resilience. Now, for years, the radiologists and physicians have been actually labeled as responsible for the burnout because of the resilience issues. I just want to quickly dismiss that. A really nice study that was carried out by Colin West and colleagues from the Mayo Clinic looked at over 5,000 physicians across the country and looked at the resilience scores using objective metrics in physicians compared to the general US population. And physicians repeatedly had higher resilience scores, which makes sense, right? If you think about the brutality of med school, internship, residency, fellowship for those of us who are fellowship trained, and then all of a sudden, oh yeah, you lose your resilience and you become burned out. It never really made intuitive sense to begin with. And higher resilience scores in physicians were associated with lower burnout rates, but even the most resilient physicians had substantial rates of burnout. That tells us that the conversation and the narrative needs to move beyond the individual physician to looking at system-level issues. What I'm talking about is redesigning processes and stop trying to redesign our physicians if we really want to make a long-term impact. So with that, let's look at culture as one of the three components. Culture is your soul. It's who you are. If you took a blood test of everybody in your group, that should be your culture test, your litmus test. And what we need to do as a specialty is to start to move the mantra. For years as an operational leader, I was trained heavily during my business training that no margin meant no mission. The practices that are doing well now have shifted and understand that there's no people, there's no mission. How do we actually implement a culture that's going to make a change in terms of the radiologists that we have? First of all, professional development is an important step. An important study from the Mayo Clinic carried out in 2009 in Archives of Internal Medicine showed that if a physician spends 20% of their time doing something they find fulfilling, they're less likely to be burned out. 20%. That doesn't always necessarily mean research or teaching. It can be things like philanthropy, being able to be engaged in nonprofits, Boy Scout movements, whatever it is that actually fulfills them. And actually getting to learn your physicians and spend time with them and being able to have them focus on things that they find actually helpful can make the difference. Secondly, I want to talk about self-care. Now, I know in this audience and historically when we talk about self-care, it's not always well received, kind of seen as foo-foo, but I'm going to tell you it matters. And this is in our own cohort, one of the hardest cohorts to actually scientifically evaluate in this country is private practice radiologists. And we have to thank Strategic Radiology, who for no other reason, which is a consortium of 31 private practice radiology groups, accepted this test, this survey data and test to look at actually the burnout prevalence. What they found is the burnout rate was about 46%, and these are people in the trenches, not leaders. And radiologists to call were more likely to be burnt out. Well, that's kind of intuitive. Also intuitive is that there was an inverse association between fulfillment and burnout, which is intuitive. Unfortunately, only about a quarter of radiologists in private practice currently feel like they're professionally fulfilled. What was very surprising to us, though, is that there was statistically associated increased professional fulfillment with eating nutritious meals and exercising at least 4 times a week. So the stuff that we've talked about for years, self-care and self-evaluation, it really does matter. Social connectivity has already been explained eloquently by Dr. Reichman, so I won't repeat it, but remember, humans have a fundamental need to connect. Also, I also want to emphasize that recognition is an important leadership tool, not because we are trying to stroke physician egos. More importantly, we're trying to create a sense of acceptance for radiologists in the group. Next, I want to talk a little bit about operations, just briefly in terms of some of the things that contribute to actually helping reducing burnout and potentially helping retain your radiologist. Number one, manage workload. Multiple studies have shown workload is the main source of stress for multiple groups in radiology, including breast radiologists. Historically, we see graphs like this which talk about, if you increase efficiency, that you improve quality and speed, and you reduce cost. Couple things though. Speed kills. It doesn't matter if you're talking about driving a car, driving a truck, or reading mammograms or reading chest CTs too fast. You're going to miss the faster you read. And the other thing I want to talk about is now that there's increasing literature and finally people are having the courage to talk about this, is the downsides of efficiency. The antidote to burnout may not just be improved professionalism, but actually slack. Creativity lives in the slack space. I noticed before that the majority of radiologists here in academics, most of your higher thought, your ability to have that serendipity that we talked about at the morning session, is to live in that space where you're not feeling pressure around you all the time. Academics, and I would argue even science, depends on us having slack space. The untold truth that nobody wants to admit and acknowledge is there is such a thing as over-efficiency. You can only go so many times faster on the hamster wheel before you fall. And these are some of the other strategies, making sure finances are looked after very appropriately, scheduling flexibility, support staffing, leverage IT, which Bill just talked about, Dr. Moore, so I'm not going to reiterate that. But I would like to talk a little bit about leadership and the increasing role we're seeing it having on our ability to be able to have successful practices. The Granddaddy study was carried out at the Mayo Clinic by Tate Shannonfield. They had over 2,800 physicians and scientists responded using validated tools to look at burnout and leadership qualities. And these are the qualities they asked people to think about with their leaders. Think about these questions. When they look at the 12 questions, what they found was there was a 1-point increase in leadership score with a 3.3% decrease in likelihood of burnout and 9% increase in satisfaction. So the point here is the leadership qualities of physician supervisors appeared to impact the well-being and satisfaction of individual physicians. There's actually a follow-up study to this, which we don't have the time to go into, that looked at 2-year follow-up, and the initial burnout that physicians initially experienced still happened 2 years later, and the organizational satisfaction decreased based on the initial supervision of the physician score. The leaders really matter from different contexts. Leaders are human. They can burn out too. What happens when they get burnt out? Well, this is a nice study from Stanford, which showed that the higher the physicians were burnt out, the leaders were, the lower their leadership score when they were assessed by their followers. The more fulfilled the leaders were, the higher the leadership score. What does that mean? Every 1-point increase in burnout score of the leaders was associated with a decrement in their leadership behavior score. Burnout, professional fulfillment, and self-care practices of physician leaders were independently associated with their leadership effectiveness. So we have to start thinking about managing the leaders themselves. Leadership, whether we wanted to admit it or not, causes and cures burnout in radiology. We don't have time to look at these, but this is initial work, which I hope other institutions will follow at, where we actually formally trained leaders within our division of diagnostic imaging. And they looked at 5 core leadership skills. We had them look at emotional intelligence, self-care, resilience support, demonstrating care, and managing burnout as part of the 5 metrics that they were trained in. And then we looked at pre and post intervention of the training, of what happened to the faculty and what happened to the leaders. These are published independently in 2 peer-reviewed journals. And basically what we showed is that formal wellness training of academic radiology leaders led to improved teamwork scores of their faculty. Secondly, for the leaders themselves, it improved their work-life conflict. So we have another opportunity potentially to actually improve burnout and reduce intentional leave by actually training our leaders. I'll stop there. Thank you for your attention.